ground up. My name is Becky Montrone. We have a business here in Keene called Wondrous Roots. So excuse me. My expertise is in the field of holistic health and nutrition. So I have a degree in holistic nutrition, and I'm also an herbalist. So we have a full formulary of herbal products. So a lot of extracts for different problems, different formulas, things like that. Topical formulas you ingest, herbal extracts and stuff. My hair is sticking out. Let's see, how did that happen? All right, let's fix that. That's better. What else? So I see clients in private consultation in person or this way via Zoom, and I see people regarding all kinds of health problems. And as many of you know who are in my Wondrous Roots family already, I don't mind a challenge. And anyway, just try to be the health detective. So anyway, Wondrous Roots is located in Keene, New Hampshire, in the Miller Forge building up on the 3rd floor. We are open 9:30 to 5 Monday through Friday. You can reach us by phone 603-439-2603. You can also go to, we have 2 websites, one that is mywondrousroots.org and kind of really focuses on information and is becoming even a greater source of information, scientific information as time progresses. And then the other one is shopwondrousroots.com. And there you will see what we have here in our shop, and you can use that to purchase online. So both of those websites, of course, have a contact us, and you can reach out to me from there. And those come to my private email, and I handle those myself. So you're not getting my staff or if you're saying something to me that's confidential or whatever, you're not getting, that's not going through a channel. My staff is fantastic. Got everybody like elves around here, not because of Christmas, but just there's a lot to do here in this place. And so Dale has been really heading up. He kind of manages the whole area of making the skincare products, which is a huge help. He's also been the person who came up with the new branding, and he takes care of getting like our new flyers done and stuff like that. We have our new brochure, which reflects, our new, updated look to our product line that just keeps morphing. And so he's like busy with all of that, and then also keeps up with the dishes and taking out the trash and other things that are, just not just even making cream. He like designed this whole mechanical computerized cutter to cut out for our new gift box. I'll show you one of those. So like right here, this is our deluxe Wondrous Skin Box. So you have to have something that will custom fit those containers, right? So he's an engineer, and he found something on eBay, and he figured something out. So he puts these in, it cuts them and all that kind of stuff. So we have that. We have Sue. If you come into the shop, everybody knows Sue. Sue's been with me for years and years and years. And she actually was with me when we started in 2005 in Londonderry. And then Sue, customer service, great. And there's so much to do and all these back end things, but she really focuses, she does a lot of her focus. She's the one who does the bath bars and the candles but many other things. And then Mary is always busy with customer service and tinctures, and then everybody's stocking shelves and all of that kind of thing. And Krista just recently came on board, and she's helping in a multitude of ways, just whatever needs done. And she's also spending some of her work time studying because she is enrolled in an intensive herbal medicine course. So everything's really great here, but I have a lot of help. I just wanted to give them some some credit there. All right, so like I was saying, people can reach me right on one of my websites. Well, last weekend, and I get a lot of people asking me questions, just if I can help them answer a question. And I had a question from a woman who was asking about having no sense of taste and smell, even since 15 months since having COVID. And I've recommended in the past to people, because Dr. Brian Ardis, I saw that he had said something about his wife using nicotine gum and chewing it, a stick of nicotine gum, like every 4 hours for a day. And that this, after all else had failed, took care of her problem. I also knew that nicotine was somehow intimately associated with COVID. I remember saying to Dale when during the lockdown, then during the early, stages of the lockdown, that that the government is so interested in telling us everything we have to do. You got to wear your mask. You got to stay 6 feet apart. You got to, I'm sorry, you got to genuflect to the sun or whatever you have to do. I said, why aren't they coming by and asking people if they've had their 6 cigarettes today? And by saying that, I was talking about the nicotine effect, and that we were seeing that smokers were having less problems when they contracted COVID than non-smokers. Now, I'm going to say right off the bat, this talk is not about smoking as being a way of getting nicotine, and it's not the optimal way. But I just said that as kind of a caustic remark at that point in time, because Uncle Sam was so in our faces. It was not, our bodies, our rights, or anything like that. It was all about you just do whatever we say and walk in line, or you could be, people ended up in jail, for running their businesses or whatever. And I don't want to go down a bunny trail, but. What's interesting is that I knew there was an association between nicotine and COVID. Of course, they know that too. And this is just another one of those things that we're not going to hear about. It's not going to be out there. Nobody's going to know because nobody's supposed to know. Because if you know about things you can do on your own, then you won't need to do what we tell you need to do. So you know how that goes. Hopefully, we got some really cool appointments to the FDA and the CDC just last night by our new newly elected president, Donald Trump. And I think we're going to see some shake up in the special interest involvement in those people telling us what we need to do for our health. So I'm super excited, more than thankful. I mean, talk about Thanksgiving for things like that. But anyway, so for this woman who asked me this question about the 15 months since she hadn't been able to taste or smell, I thought I want to look into this a little bit more deeply. And this is what I found. So I'm going to share my screen in a second. See, I'm going to shake it, bring it down a little bit, because this is super exciting. And this is why sometimes I'm like, because I work a lot and I take care of a lot of people and I answer a lot of questions. And sometimes I'm like, I get a question and I'm like, oh no, not another question. But then I pursue it and I always learn something that just, oftentimes something that just mushrooms into something that is so helpful for others. And I'm so glad I did in this case. And I always do follow up, but I was just like, again, I learned something. You guys know, a client asked me about, what do you know about methylene blue? And I was like, oh, what do I know about methylene blue? Then I'm like, what do I know about methylene blue? Wow. So anyway, I'm going to share my screen. There we go. All right. So I said all of that. Okay. So this is really cool. I'm going to give a little, just overview about what I'm about to say. And that is, And basically, this study was done. I'll open it up. Okay. Okay. And oh, if you want to participate, and I got to get you guys down here. Let's see. Where are you? Chat. Move you here. If you want to, chime in, go to the chat, type it in, or go to Q&A, type it in, or hit, I always do that, or hit raise your hand and I'll call on you and you can speak. Okay. I'll try to keep good tabs on that. Okay. So is a post-COVID-19 syndrome a severe impairment of acetylcholine orchestrated neuromodulation that responds to nicotine administration? So the skinny on this, in my words, is that we thought, at least I thought, that the reason people who were using nicotine had less trouble with COVID-19 was because the nicotine was locking into the ACE2 receptors, where the virus, okay, so the virus gets into your body. What does it do? It just doesn't it wants to access you, so it finds these receptors that it has an affinity for, and it locks in. And that's how it gets in. So certain things are like ACE2 receptors and receptor blockers. So I think Paxlovid works on that process, but melatonin works as an ACE2 receptor blocker as well. So does dandelion leaf, things that I talked about earlier on. Oh, and let me show you. I did, in the wake of doing this, I just cascaded from answering her question and getting this article going to building my whole COVID-19 page on my website, which I had not done yet. So I want you to know it's there. Many, many files from my files on COVID-19. So you will see very, 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 very many files that you can just see what you're interested in, and anything you want to find, you can click on and wait. Let's see, I'm not sure why that took so long. Pomegranate and sumac for COVID-19 symptom relief, right? Or something like that. All right. But anyway, back here. So there is that page. And then I talked about how I stumbled on to all of this, and then that page, that paper I'm working on right now. So I'll get out of that. There I am. Okay. Okay. So no. So there's this other whole receptor, and that's where this whole snake venom thing comes in. People have talked about snake venom. So snake venom also uses these same, what we're going to see are nicotinic acetylcholine receptors. They're very involved in neuromodulation. So very key. We're going to see, if you've seen my newsletter already, we're going to be delving into nicotine and Parkinson's and Alzheimer's and things like that. Now, one of my clients with Parkinson's was reading up on nicotine for Parkinson's not long ago. And this is before I stumbled into all of this. And he has started using nicotine patches for that because of the information that he found. And so very, very interesting. My father, my compound pharmacist father, brilliant man when it came to medicine and health, for years said that people who smoked had less Alzheimer's. My mother had Alzheimer's very young. It kind of gave him a way to keep smoking for a while. So that's not what this is about. And yet, don't you find, I think sometimes the information about the health benefits of something like nicotine are hidden from us because they're not politically correct. Oh no, somebody might think they can, that justifies their smoking. Well, don't worry about it, right? Don't worry about it. That's not your business, government, or people who are censoring information. That's not your business. Yeah, I mean, people who decide to use nicotine can decide to use it however they want. And we don't have to worry about, are we advertising to them? by saying that nicotine has health benefits when meanwhile, we're pulling the rug out from under the health of people suffering from serious disease. This long haul COVID syndrome is really bad. So anyway, the nicotine locks into the nicotinic acetylcholine receptors and blocks the latching on of the virus, the COVID-19, the SARS-CoV-2. Now, right there, what does that tell you? Well, isn't that a prevention? What, do I wear a mask on a plane, or do I wear a nicotine patch while I'm traveling? If I'm going to be somewhere where I think I'm at risk, why not put on a nicotine patch, low dose nicotine patch? When it comes to long haul COVID, what it does is it bumps out the virus. You get that nicotine patch on, and it now dislodges. It's like you are squatting in my spot. Why? Because it has a much stronger pull. Nicotine has a much stronger pull to the acetylcholine receptor than acetylcholine does itself. So certainly more than SARS-CoV-2, the virus responsible for what we call COVID-19. So this is exciting because this study takes us through 4 case stories. This was published in 2023, so very recent. I'm just going to read the abstract here. Following a SARS-CoV-2 infection, many individuals suffer from post-COVID-19 syndrome. It makes them unable to proceed with common everyday activities due to weakness, memory lapses, pain, dyspnea, which is shortness of breath, and other unspecific physical complaints. Several investigators could demonstrate that the SARS-CoV-2 related spike glycoprotein, SGP, attaches not only to ACE2 receptors, but also shows DNA sections highly affine, have a high affinity to nicotine acetylcholine receptors. The nicotine acetylcholine receptor is the principal structure of cholinergic neuromodulation. Okay, so anybody who followed me, you guys who were with me during the whole Alzheimer's series, Outsmarting Alzheimer's series, right? I talked so much about acetylcholine because acetylcholine is the neurotransmitter that really goes missing when it comes to Alzheimer's disease. So things that modulate acetylcholine in a positive way are a plus for prevention and treatment. This is super exciting. Okay. As a principal structure of the cholinergic neuromodulation, it is responsible for coordinated neuronal network interaction. Non-intrinsic viral and acetylcholine receptor attachment, such as SARS-CoV-2. So that's non-intrinsic. It doesn't come from within. It's coming from without. Compromises integrative interneuronal communication substantially. This explains the cognitive, neuromuscular, and mood impairment. So remember, during COVID, when everybody was having COVID, one of the things some doctors were recommending was an antidepressant. And I also found, and I have in my COVID page there, if you see it, the role of serotonin and how serotonin is affected with SARS-CoV-2. But now this sheds the light on how. Why? Because of this, I believe, because, it makes all the sense, locking into the nicotinic acetylcholinesterase receptors. And so we have, anyway, yeah, it's huge. Now let's just I keep kind of bouncing off, but now let's extrapolate that to people who have been vaccinated. So, right, that same spike protein, wouldn't that be the same problem? So wouldn't this be a remedy for, or a treatment, a therapeutic treatment for post-COVID vaccine problems? I would definitely think so. I would also think if somebody was forced to have to get a vaccine and they saw no way out of it, they could have protected themselves with some nicotine use a few weeks before they got it through a transdermal patch, and maybe have kind of outsmarted the whole thing. Well, part of it, I don't know, but that's where that makes some logical sense to me. Unbelievable. This is why I say we have so much more power than we know. We do. Don't go with the flow, go with the no. This is huge. What I'm saying right now is huge. And I now have, because this woman went to my website and asked me a question, and I felt I needed to give her a better answer than, I've heard that chewing nicotine got, I felt I had to give her a scientifically backed answer. I now know this. Okay, so the agonist ligand nicotine. Okay, this explains the cognitive, neuromuscular, and mood impairment, as well as the vegetative symptoms characterizing post-COVID-19 syndrome. The agonist ligand nicotine shows up to 30-fold higher affinity to the nicotinic acetylcholine receptors attachment than acetylcholine itself, 30 times more. Wow. That, I'm just thinking of applications of that elsewhere than what we're talking about right here. But anyway, we therefore hypothesize that this molecule could displace the virus, get out of here, bump from the nicotinic acetylcholine receptor attachment, and pave the way for unimpaired cholinergic signal transmission. The dam is broke, right? The dam, it's open. Now those signals can go back and forth like they were going before you had COVID, or possibly, and I would think logically, before you had your COVID vaccines. Now that blockade is gone. And now things move freely like they used to. So, treating several individuals suffering from post-COVID-19 syndrome with a nicotine patch application, we witnessed improvements ranging from immediate and substantial to complete remission in a matter of days. A matter of days. So what they had them do was they had them wear they said 7.5 milligram. I can't find a 7.5 milligram nicotine patch. I can find a 7.5, a 15 milligram, and a 21. So when people are quitting smoking, what they do is they start with the 21, right? Because they're used to a lot of nicotine. And so they use the 21 to help stop their cravings. And then you go for a matter of so long, I'm not sure exactly what it is. And then you go step down to a 15. Then you go for a matter of so long, and you step down to a 7 milligram. So they use the lowest dose with their 4 participants. And the results were quite amazing. Now, they used the patches for 7 days, just 7 days, but the remediation of symptoms continued on for up to, I think in the longest case, like they kept going and going and going and going and going. Some were immediately gone within a few days, going and going and going and going until ultimately gone in a matter of, I think the longest was 21 days. This is remarkable because there's really nothing that I know of that, the mainstream medicine really has to offer people with long haul COVID, other than recommending them to a psychotherapist. Long haul COVID is interfering with some people's ability to work, just never being able to get back. So again, this is groundbreaking in my opinion. I think not enough people know about it. It's there, they just don't know to do it. So blah, 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 blah. They talk here, you might want to really go through here. I'm not going to read, obviously, this whole thing. It would take over the time we have. Talking about blah, blah, blah. And then it talks some about, anyway, we'll go through all of that. Is it just the ACE2 receptor? So that was the question. See, we were thinking ACE2 receptor, and we talked about that. The pivotal neuromodulation role of nicotinic acetylcholine receptors, nicotine effect on the nicotinic acetylcholine receptors, and you can see how that works when you're using nicotine. Then diagrams, which are, I don't know about you guys, some people really love these diagrams. It is not my way. I can picture things when I'm reading and the way I want to picture them. So I don't like usually follow these things, but a lot of people like that. That's learning style, right? Okay. Anyway, it talks about that. Okay. Okay. Yeah, and they use the low dose. They talk about people vomiting and stuff like that. If you start in with a high dose of nicotine, like you don't want to say, well, I want my symptoms to go faster, right? Based on this study, what I learned from this study. You don't want to say, well, I want my symptoms to go faster, so I'm going to just put on a 21. You might be having diarrhea and vomiting. So you don't need that. You don't need so much nicotine that it causes those effects, gastrointestinal problems. And that doesn't happen at the lower doses. Let's see here. Okay, so what I want to kind of go is to the results. So the methods, let's go there, the material and the methods. Okay. We investigated one female, 32 years old, and 3 males, 19, 41, and 52 years old, respectively, who suffered from numerous symptoms indicative of post-COVID-19 syndrome following a PCR confirmed SARS-CoV-2 infection. So let's just say everybody had to be confirmed that they had COVID with a PCR test back when they had it. And then when they went in to do the experiment, to start the experiment, they tested them again to make sure they didn't have an active infection. The patients, okay, so these were who suffered from numerous symptoms indicative of post-COVID-19 syndrome following a PCR-confirmed SARS-CoV-2 infection with a subsequent mild course of disease. The patients described weakness, dyspnea, shortness of breath, sleep disturbances, dizziness, complete ageusia, and anosmia, which is the can't taste or smell, along with a variety of other symptoms, anosmia, with a variety of other symptoms. Except for the youngest, the patients were not able to continue activities of daily life compared to the period before the SARS-CoV-2 infection. In fact, so their lifestyle, their ability to function at the level they were, to continue their, the things you do, your job, your family, your home, your yard work, whatever. As these multiple unspecific symptoms had not improved over a certain time period without signs of acute COVID-19 infection, they visited our outpatient clinic. So after meticulously explaining the hypothesis described above, as well as the expected effects of nicotine and possible side effects, the patients were advised to apply a standard nicotine patch. Since all included individuals were nicotine naive persons, right? So that means they had not smoked, or they'd not been nicotine users in the past. And that's a really good important point here. Right. So it might mean that a person who is already a smoker or something might need a higher dose. Although, anyway, we'll stick to this study. But anyway, like I'm a nicotine naive person. Well, I mean, I smoked like maybe 40 years ago, stupidly for a short period of time, but that doesn't matter. That's not nicotine. There's no nicotine in my system. So I think like that's another good important thing to say. Nicotine naive, you haven't smoked for a while. Doesn't mean you've never smoked in your life. All right, and to administer the patch once daily in the morning. All patients followed these instructions, except for the 41-year-old patient. He mistakenly purchased the patches in a higher dose, the 15 milligram, than recommended. You hate that when you're an investigator, right? You're doing this, what? You used the wrong dose, but anyway, you just ruined the whole experiment. No, but anyway, in all cases, we asked patients to register their symptoms starting 4 days before applying the nicotine patch and to score the severity of their complaints on a scale of 0 to 5 daily. The 19-year-old otherwise healthy patient was diagnosed with SARS-CoV-2 infection by a positive PCR test on March 26, 2021. Patient reported a mild course of the acute infectious disease with symptoms such as mild fever, sore throat, and feelings of weakness, which resolved completely within 10 days. Approximately 3 weeks after the detection of the infection, the patient noticed a sudden loss of sense of smell and taste, alongside general fatigue. These complaints persisted over the next several months with minimal undulation in symptom severity. On presentation to our outpatient clinic in November of 2021, we counseled the nicotine-naive patient about the apparent expression of post-COVID-19 syndrome and informed him about the difficult diagnostic and therapeutic approach to the described symptoms. The patient consented to the off-label use of percutaneous nicotine application and began 24-hour applications of nicotine patches, 7.5 milligrams for 7 days on November 23rd. Oh, it's November 23rd today. That was 2 years ago. No, 3 years ago. In the days leading up to COVID application, a weakness was recorded in the range of the 2 highest possible levels 4 to 5. And anosmia and ageusia were reported, that's taste and smell, right? Were reported at the highest possible level, level 5. During nicotine-based treatment, recovery from weakness was most rapid. A daily reduction in symptom severity was achieved, allowing level 2 to be reached on day 3 of treatment and maintained for an additional 3 days. Level 1 was reported on day 6, and by day 9, the patient reported being weakness-free. The loss of taste was reduced by 1 level on the first day of treatment, dropped to level 3 on the 3rd day, dropped further to level 2 on the 10th day, and reached level 1 on the 13th day. On treatment day 16, the patient described the full restoration of his sense of taste. Now, at first, I thought that they just kept using the patch till everything was gone. But then I found out I was wrong. I won't look for that right now, but they were to do this for 7 days. Use to administer patch daily in the morning. Yeah, I've got to back down on, I've got to look that back up. If you don't mind, I have to satisfy my, oh, yes. He began use of percutaneous nicotine application and began 24-hour applications of nicotine patches for 7 days. Okay, yeah, I just read it, but I missed it myself. Okay, because that's the important thing. Because at first I thought I missed that when I was, and I was thinking that you just keep going because I saw people using, improving out to like 21 days. And I'm like, so you just keep going with the patches. Not that there would be any harm. In fact, I've decided I'm going to start wearing a 7 milligram patch daily, just as part of my health routine. And you'll see why when we get to some other things here. But anyway, so if we ever do, I keep taking up time. Anyway, I'm sure you find this fascinating as I do. Okay, so his weakness went by day 9. Okay, the loss of taste, sense of taste and smell was by the 13th day. Oh, that was the loss of taste. On treatment day 16, the patient described the full restoration of his sense of taste. Wow, there's so many people out there suffering from this. A similarly protracted symptom reduction was seen with anosmia, the inability to smell. Beginning on day 3, the patient experienced reduction from level 5 to level 4, dropping further to level 3 on day 7, to level 2 on day 10, and reaching level 1 beginning on day 13. From day 16, the patient reported being able to smell to the same extent as before his SARS-CoV-2 infection. In a follow-up interview, approximately 6 months post-intervention, the patient reported being symptom-free. Now, if medicine had been on top of things during the COVID craze, the pandemic, you would have gotten your PCR test, positive test, and a prescription for some nicotine patches, right? There you go. You know, I think of people, you know, even my husband, who had huge, and men tended to have a bigger problem with huge fatigue in the legs that went on. So we find out you have COVID, let's give you a nicotine patch, let's keep you out of the hospital, let's keep you off the ventilators, let's keep you off remdesivir, let's just get you well really quickly. I mean, one might argue, is our nicotine transdermal patches like another option alongside something like ivermectin? I think this is huge. Anyway, with the onset of nicotine administration, the patient experienced diarrhea for 2 days, terminating spontaneously and considered mild. So he didn't terminate the study. He had some diarrhea. Stools were loose, considered mild by the patient. So he didn't cause him to want to stop. But if you want to go more slowly, you can just cut a patch in half to work your way up. So you're getting 3.5 milligrams, right? Just cut it in half, put it on there, use it for a few. Who cares if you can do it any way you want. And this person had moderate symptoms, fever, reduction in smell and taste, loss of appetite, headache, pain in the limbs, reduced memory, lack of drive, and rhinitis, which is like your runny nose, as well as neck, limb, and back pain. That was the acute infection, lasted until December, blah, blah, blah. From that time onward, she had numerous symptoms such as chronic fatigue at a level 4, loss of smell and taste, level 1, marked difficulty concentrating, level 4, headache, level 4, considerable exercise intolerance, level 4. Information, education, informed consent, and nicotine therapy were given to the otherwise healthy, nicotine-naive patient, as described above, 7.5 milligrams for 6 days in her case. Starting on day 2 after the initiation of therapy, the patient reported a reduction in fatigue 1 level per day. Fatigue was completely reversed by day 4. Completely reversed by day 4. She had said her chronic fatigue was at level 4 out of 5. Wow. I mean, that's fast. That's not like you need to do this for a year and maybe you'll get better. Whew. Okay. And day, okay, blah, blah, blah. Recurrence of fatigue to a lesser extent. Okay. Fatigue was completely reversed. From the 6th day onwards, however, the patient experienced a recurrence of fatigue to a lesser extent, level 3, which then progressed as follows. Day 13, level 2. Day 20, level 1. And day 23, level 0 on the fatigue thing. Now, she did this for 6 days. That makes me wonder, like, since they're not harmful, why wouldn't you just hurry things up and do this for longer? But they had a, you know how studies are done. You have got to fit a model and everybody's got to follow that model. But she did 6 and he did 7, so I don't know. The patients, okay. All right, I like this. The patient's reduced retentiveness, retaining information, was perceived as very high, level 4, before and at the beginning of treatment. It dropped significantly from the 3rd day following nicotine administration, level 2, 3rd day, and was no longer perceptible from the 4th day onward. Wow. In the same manner, the ability to concentrate was impaired until the concentration performance perceived before SARS-CoV-2 was regained from the 4th day after the initiation of nicotine therapy. My. Similarly, the markedly impaired exercise tolerance, level 4, dropped significantly on day 3, level 1, becoming unreproducible on day 4, but rising again slightly on days 5, level 2, and 6, level 3, only to fall continuously thereafter from day 8. So that's really an important thing. If you're going to do this for your long COVID, and I say go for it, if you were like, well, I thought it was helping, but then it didn't, right? No, just wait. From the 24th day, 24 was the longest one, I guess, one, day after nicotine application, the patient reported full recovery of her physical performance. Starting on day 2, the patient experienced a very unpleasant feeling of tightness in the thoracic region, which was reported to be undiminished, levels 3 to 5, until day 13 after the start of nicotine therapy. It decreased continuously from then on, level 3 on day 14, level 2 on day 19, level 1 on day 22, until complete remission was achieved on day 23. We attributed this symptom, which began directly with the start of nicotine administration, to a side effect of the active substance nicotine. The patient considered these symptoms to be associated with nicotine as well, which is why she elected to stop the nicotine therapy on day 6. As opposed to continuing until day 7, as we had recommended. This decision was due to the otherwise very good symptom remission until the 4th day of nicotine administration, all symptoms at level 0. In a telephone interview after approximately 6 months, the patient confirmed that there had been no recurrence of her symptoms. Also, they talk later on about the fact that she had this tightness in the chest was not a heart issue. So it can be a nicotine side effect that does not involve the heart, but you might want to be aware of that. I recommend that you read this through. It's really cool. So we have another one here. He used too much. He used the extra one and had vomiting after. Anyway, despite the cessation, he decided to give this up, but he used too much. Unfortunately, the patient did not administer the recommended dose of 7.5, but mistakenly doubled it, which led to intolerable vomiting and diarrhea. Within 7 hours, the patient discovered the therapy after 10 hours. Despite the cessation of nicotine use, chronic fatigue decreased significantly on day 2 after nicotine use. Stage 2 continued to decrease on day 3, stage 1, and was no longer detectable on day 4. Similar to the cases previously described, the symptoms of as anosmia and loss of taste showed a rather protracted yet continuously declining course. He used it for 10 hours, too much, made him sick. But I mean, it gave him side effects, but it still had its action that continued to work. So after a decrease, blah, 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 blah. After a decrease to level 2 on 14th day, the patient was able to fully perceive all smell and taste qualities on the 15th day. And this was after only 10 hours on that 15 milligram strength. All right. So you get the idea. And you can, this is a really well done study. I think this is, again, groundbreaking. Of course, thank God we can get transdermal nicotine patches ourselves without needing a doctor's prescription, because if we needed a doctor's prescription, that would be called off-label use, and then we'd have to go through all kinds of rigmarole for you to be able to use it for this. And they'd say, well, there's not enough evidence that shows, so no, we won't prescribe that for you, but we'll prescribe, an antidepressant and a psychotherapist to help you deal with the fact that your ability to function in life is so impaired. Anyway, do I sound a little skeptical? Yes, well, that's because I am. Okay, so we're going to go back to this. All right. Let me see if Kathy, you are with us today. At the very end, I wanted to find out what about stroke recovery, right? Because you are recovering from this stroke. By the way, I am making your facial stuff like right after I'm done with this today, because it's so hard to get in an extra compound like that during the week. But I promise. And I have another woman I'm using it for who's got has shooting nerve pain after a protracted course of vomiting and stuff. So I'm hoping this is really going to work. I'm going to be using like DMSO, vitamin B, palmitoyl-ethanolamide, PEA, emu oil, probably some P5P, some pyridoxal biphosphate, which is activated B6. But anyway, let's go back to nicotine. So there's a post-stroke cognitive deficit, which Kathy doesn't really seem to have, because we've talked and everything. She sounds really cognitively absolutely right there. But I don't know. Just know that this is here if you decide you want to use it. They said, we summarize the current management strategies used for post-stroke hemispatial neglect. I don't think she has that, but anyway, but some people do. So maybe somebody does that out there watching this video, okay. With the options including non-invasive brain stimulation, visuomotor feedback training, robotic rehabilitation, and transdermal nicotine patch. Okay. Now, but let's go to this, the 10 surprising benefits of nicotine. This is a really good paper. Nicotine has got a bad reputation, right? But did you know that reputation is largely unfounded? In fact, some evidence suggests that nicotine alone isn't that addictive, and that it is the other chemicals found in tobacco smoke coupled with the behavioral aspects that make smoking as addictive as it is. Possibly this is the reason why nicotine receptor therapy why NRT is ineffective. Some studies find that smokers who use NRT have the same relapse rates as those who do not use NRT. I'm not sure about that. Oh, maybe that okay, anyway, whatever. Let's not worry about that. Nicotine by itself is actually viewed as the least harmful of all the compounds found in cigarette smoke. And what's more, nicotine may actually have medicinal benefits for a number of conditions. Professor Pelosa pointed out the first global forum on nicotine 2014, that nicotine is not the reason for smoking related disease. This is a really important thing because people have such a bugaboo. It's kind of like CBD, because CBD, it's non-addictive, it's non-psychoactive, and but it comes from cannabis. Oh, it makes me feel weird. It is not cancer causing. It does not cause lung cancer. It has a minimal effect on cardiovascular disease. Actually, it actually reduces blood pressure. It lowers blood pressure. With all this in mind, we've been digging into possible benefits of nicotine. Okay. Also, blah, 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 blah. Smoking is incredibly bad for you. They warn you. I didn't bother doing that on mine. It's like, everybody knows that, right? Hard to tell people. Now, I hope this doesn't make you go out and smoke. Like, are we idiots? Okay. Okay. Wait a second here. Okay. Parkinson's disease. Blah, 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 blah. Unsurprisingly, found that there was a higher mortality rate. Unsurprisingly, he found there was a higher mortality rate for smokers who were prone to numerous diseases such as lung cancer, blah, 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 blah. What was surprising, however, was that non-smokers were 3 times as likely to develop Parkinson's disease than smokers. So he was looking at health insurance data, right? I should have said that. Health insurance data in the US military between 1917 and 1940. And he was like, that's very interesting. Initially, Kahn's results were thought to be an anomaly due to smokers dying younger because of their smoking-related illnesses before they reach the age at which Parkinson's typically begins to develop. But follow-up studies, such as Kessler and Diamond's investigation of Baltimore residents with Parkinson's disease, confirmed that Kahn's conclusion was true. It soon became apparent to neuroscientists that it was the nicotine molecule that was responsible for the prevention of Parkinson's disease. This molecule could regulate other receptor systems in the brain, primarily the dopamine neurotransmitter. Dopamine plays a number of roles in the human brain. It regulates attention, reward-seeking behaviors such as gambling, drug addiction, and most importantly, in the case of Parkinson's disease, movement. Based on these emerging findings, Marika Quick used nicotine to treat monkeys with Parkinson's, and the results were remarkable. After 8 weeks, the monkeys had half as many tremors and tics. Additionally, the monkeys who were being treated with the standard drugs for Parkinson's, L-DOPA, had reduced dyskinesias, the side effect from the drug, as much by as much as 35%. That's one of the problems with levodopa, right? Is it has its own side effects, which are very similar to the symptoms of Parkinson's. So it's like there's nothing really great out there in the mainstream medicine world for Parkinson's. Since then, many studies have come to the conclusion that nicotine has the potential to protect against ongoing degeneration by slowing down or halting the neuronal damage that stems from Parkinson's disease. Further studies on the effect of nicotine in those with Parkinson's disease should give us more understanding of how it actually works in the future. That's huge. And my client who's using them, has probably been using them now for a month, is going to report back to me, but they say to give it a couple of months to really expect in the information he had to pass judgment. on whether this is helping you. Nicotine and preventing Alzheimer's and protecting against Alzheimer's. Nicotine, nicotine shows promise in delaying the onset of Alzheimer's disease, as well as mitigating the associated symptoms due to its neuroprotective effect. No cures have been found for this. Okay. A study of people diagnosed, they really needed somebody to edit this. A lot of run-on words here. But anyway, a study of people diagnosed with mild cognitive impairment and onset of Alzheimer's over 6 months found that those treated with nicotine demonstrated statistically significant improvement on their reaction time, memory, and attention. Newhouse, the author of the study, concluded, nicotine, seems very safe even in non-smokers. In our studies, we find it actually reduces blood pressure chronically, and there were no addiction or withdrawal problems, and nobody started smoking cigarettes. The risk of addiction to nicotine alone is virtually nil. And then there's like, if you're wondering about that, there's an article you can click on there. Nicotine as a treatment for ulcerative colitis. Ulcerative colitis is chronic inflammatory bowel disease similar to that of Crohn's, but although they affect similar areas of the body, they react very differently to the effects of smoking, with symptoms becoming much more severe for those with Crohn's disease, but vastly improved with ulcerative colitis. Ulcerative colitis is typically a disease of non-smokers and ex-smokers, and evidence suggests it is the anti-inflammatory properties of nicotine and tobacco smoke that could be the cause. In clinical studies where transdermal nicotine was given to patients suffering from ulcerative colitis, significant improvements in the condition were observed. Additionally, none of the subjects had recognizable withdrawal symptoms after 6 weeks of treatment with nicotine. Dr. Kathy is asking, is it good for fatigue? It should be. That's why they have you put it on in the morning too, so you're getting your most activity. I would think it would be for general fatigue. That would be my guess. But I don't have anything like right on my fingertips scientifically to answer that. Should it be worn for 24 hours a day? Yes. So you would wear it in the morning for 24 hours and then replace every next day. That's Cindy. Thank you for those questions, guys, girls, friends. Okay. Additionally, none of the subjects had recognizable withdrawal symptoms after 6 weeks of treatment with nicotine. Enhancing memory with nicotine. Jennifer Rusted, professor of experimental psychology at Sussex University in Britain, tweet this quote: one study on the effect of nicotine in young and aged monkeys showed significant improvement in matching to sample tasks as well as their retention. A more recent study on humans concluded that nicotine enhanced prospective memory. That is, remembering things for the future, such as to charge your e-cigarette battery when you get home from work. That's a great example. Oh, okay. Well, I guess because those people were smoking or whatever, but retaining, oh yeah, I got to remember, I got to pick this up at the store, or remember to pay that bill on the whatever. Yet another study found positive effects of nicotine on response time, attention, short-term memory, and working memory. I really think that this would be, don't you think, Kathy? I think that this could be huge for many different things that go with this post-stroke recovery you're going through. I really do. Anyway, nicotine lessons, start slow. You know what I mean? So you don't have any side effects, like cut the patches in quarters if you want, and kind of build up to a 7. Okay. Nicotine lessens symptoms of Tourette's syndrome. That's a horrible, horrible syndrome to have. When you have full-blown Tourette's, it is horrible. Many studies have shown that nicotine can reduce tic severity and frequency and improve behaviors related to inattention. And again, you can click on these and you're going to find studies. The effects of nicotine plus haloperidol, Haldol compared to nicotine only and placebo nicotine only and blah, 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 blah. So you can really, this is another one of those papers you can just run with if you have interest in a certain area and want to learn more. And improve behaviors related to inattention in patients with Tourette's. The reduction in these involuntary movements has been associated with nicotine's ability to turn off certain nicotine receptors in the brain. Very cool. It can turn off certain nicotine receptors. That's fascinating. The author of one study concluded that not only was the nicotine patch effective, but a much smaller dose of the medication, Haldol, could be given. So Haldol is the medication that is typically given to help inhibit the tics that come with of various kinds that come with Tourette's syndrome. There was no evidence of nicotine withdrawal in any of the subjects. So they do the test and then the people complete the test and probably stop doing it. So, and then they observe to see, did you have withdrawal? Did you have a problem with withdrawal symptoms when you went off? That's important to know. Attention deficit, ADHD, the most common behavior, blah, blah, blah. There's no cure for the disorder, so they say, but could interventions using nicotine patches? Quite possibly. Studies have shown that nicotine can alleviate the symptoms of ADHD by increasing an individual's alertness, reducing muscle activity, and thus restlessness and impulsiveness. Got to keep moving, calming the patient and elevating their mood. Page has since been removed. Yeah, somebody probably didn't like that and took it down, right? Of course, no one is suggesting children take. See, that's why I put all my pages on my website. I put them as attachments to my files. They're PDFs. So when those things get removed that I grab, it doesn't matter. They can still at least be found on my website. I have no idea why that was removed, but I'm just saying that's why I do it that way. Schizophrenia. Saying people with schizophrenia are more prone to smoke, and the studies this might be a form of self-medication. Clinical studies have backed this up, suggesting that the ability of nicotine to raise the dopamine levels in the brain reduces the negative symptoms of schizophrenia, as well as an increase in their capability to communicate with people and improve their concentration. People's lives people suffer so much. People suffer so much. So learning things like this to me is just to have another tool in the kit to try, right? It's just amazing. Nicotine for the relief of depression. Smoking to improve. We have to go back into smoking all the time. But one study smoking to improve one's mood has been a controversial subject, but one study conducted in 2006 confirmed that nicotine led to a significant decline in depression and an improvement in symptoms of depression. This is thought to be due to nicotine stimulating areas of the brain, resulting in the release of serotonin and dopamine, two chemicals lacking in people who have depression. Observations have shown that those prone to depression are twice as likely to be smokers and are less likely to succeed in quitting, possibly due to these therapeutic effects of nicotine. Well, that makes all the sense in the world. It makes perfect sense. And then potential in combating obesity. Smokers tend to have a lower body weight than non-smokers, although, of course, the negative effects of smoking far outweigh, right? We know that. However, research into the effect of nicotine on the brain have given hope that drugs could be developed that help smokers quit without gaining weight, as well as to combat obesity in non-smokers. One study found that mice reduced their food intake by almost half and lost up to 20% of their body fat when treated with nicotine. Additionally, nicotine has appetite suppressant effects, which lead to decreased food intake and weight. Nicotine and delaying the onset of arthritis. Almost done, but I think this is exciting. The anti-inflammatory quality of nicotine may also prevent joint inflammation and delay the onset of arthritis. A recent study on 11,000 older Australian men found that those who smoked were up to 51% less likely to need surgery to replace hips and knees damaged by arthritis, even when weight and obesity was taken into account. The authors of the study believe that this could be down to nicotine stimulating the activity of the cells found in joint cartilage, which could help lessen the severity of osteoarthritis. That is really huge. I mean, I want to do a quick look. I think, just see. Karen is here. Karen, I'm going to do a quick search for nicotine and fibromyalgia. See if we. Yeah, here we go. Again, long COVID, This is myoencephalic chronic fatigue syndrome and fibromyalgia. Going through brain fog helper, another one, enhanced exercise, clinical trials. I know I found this paper the other day for somebody who we're using. We just started using this for that because of that. Anyway, we should discuss. But yeah, it makes sense that it would be, especially nicotine plays a key role in the cholinergic system, a system that presents with fascinating possibilities for diseases like the myoencephalic chronic fatigue syndrome and fibromyalgia, which feature an underactive parasympathetic nervous or rest and digest system. All right. So this applies to you, Karen, as well, I think. Huge. Could be other people like Jean. I mean, I'm going to start using them. I'm just like, if this is so protective and keeps your cholinergic system moving properly, like, why wouldn't I? So anyway, I think this is all super exciting. And I hope you think so too. I just think, I don't know what to say, except we're running late. So I'm going to say happy Thanksgiving. I hope you have a wonderful rest of this weekend and a blessed week next week, and that you are able to really enjoy your holiday. I probably will be here. We're not open Thursday or Friday in the shop, but I'll do a Zoom. I'll still do a Zoom because I like doing these. This is fun for me. And I don't want to miss. So I'll be back. And if you're available, that would all be good. Oh, wait a minute. We've got a couple of questions. Dr. Artist uses Rugby brand. Is this good? I don't know of any brand I don't know of any brand discrepancies. I picked out an inexpensive one on Amazon that's like $15 for 30. Nicoderm is like, $39 for 14. So I don't, as long as it contains the said amount of nicotine, I don't really care about the brand. But if you want to be more careful with the brand, and Dr. Artis is a very good source of information. Then I have another question. My uncle was recently diagnosed with lung cancer that is not operable. I'm hoping something can help him that is, I think she means not too toxic. I'm not sure what you mean by helping him. We didn't really talk about nicotine with regard to cancer. So I think if he's a smoker and he wants to, I think nicotine would basically help anybody's system work better. I say that without, I don't know, maybe there are some people. So are you asking if it would help with his cancer? Is that what you're asking? Just waiting for a reply there. I don't see any overlap to cancer yet. I would definitely look into it, but I don't see nicotine. Maybe if I share my screen, if you have to drop off, I understand, but this isn't radio. We can always usually kind of do what we want, right? Let me see. Let's see if we say, oh, wait, I lost you guys. Yeah, I don't know. The thing that I'm seeing here is like all, hmm. The influence of nicotine on lung tumor growth, cancer, chemotherapy, and chemotherapy-induced peripheral neuropathy. Okay. They say there's conflicting inconsistencies. Some say nicotine can stimulate lung tumor growth, and others are saying drum efficiency is more consistent, although this latter effect has been demonstrated primarily. I couldn't recommend one way or the other right now. I'd really have to look into that more deeply. But if you, Allison, if you go to wonderstruths.org or .com and message me, I will look into it and see if I can find more out about that. Good question. Very good question. All right. And I wish your uncle the very best. I'm very sorry about that. Cancer is horrible. We see 2 and has traveled to 3 lymph nodes. Okay, I will, if you contact me, Allison, I will get back to you. I have to say, we see so much cancer right now, and there are reasons for that. But in any case, be well. Again, have a whoops. Okay, somebody's asking, years ago, I smoked a cigarette. I went into anaphylactic shock. So does being allergic to nicotine that was inhaled necessarily make it off limits in any method of use? What do you think? I don't know. But I wouldn't recommend it. Yeah, I mean, anaphylactic shock is pretty severe. So I would proceed with caution there, Jean. Okay. All right. So I'm going to say goodbye. Goodbye. Be well. Happy Thanksgiving. And thanks for being with me. I really, really appreciate it. And I hope you've enjoyed this as much as I have.